I think there's the potential now with integrated care systems. There's the potential there in terms of us commissioning structures and organisational structures to do some of that bringing together. So I think that's it's definitely a facilitator to the process. I think it is a real challenge though, and we have organisations that are very embedded in cultures that are very separate from each other. So that sort of disconnection of between primary, secondary, charities, community services, but I think it's the structures changing could facilitate that more integrated approach to care provision and organisation of care. And then I guess within that, I think there's lots that we can do as practitioners or as leaders of healthcare to try and do some of that bringing together, getting a better understanding of how the other sectors work, perhaps working across sectors. So if people have the opportunity to work in settings which are different to their own, it really sort of challenges your thinking. So when we're sort of training healthcare staff, I think that's really essential. That healthcare sort of for nursing or allied health professions and for medicine, that it doesn't all happen in hospital. That there's a view of what takes place outside of hospital. As an example. So I think education, training, and then opportunities to bring people together for learning as part of their CPD. If we can do that in kind of mixed groups or in multi-professional and multi-sector settings, I think that's a real enabler to that more integrated approach to thinking, and then hopefully that leads to all kind of changes in practice and policy.